Hello everyone. So before we start, let me introduce myself. My name is Trupal Rathod. I'm a clinical pharmacist and I run a YouTube channel where I upload medical related tutorial videos on a regular basis. So if you are new to my channel, then kindly go through my channel, subscribe to my channel, like my videos and share it with others. So now let's talk about role and responsibility of community pharmacist in COVID-19 pandemic. So we all know that the current ongoing outbreak of COVID-19 is a threat to global healthcare system, right? This disease has caused severe impact on every level of society, and with this global lockdown, the pharmacist, or we can say the community pharmacist, is the first point of contact to provide public healthcare needs. So in this situation, there is a greater dependence upon community pharmacist, right? So before we discuss role and responsibility, let's understand that why community pharmacist is an essential healthcare professional in this pandemic situation. Why there is so much importance of community pharmacist in this current ongoing outbreak of COVID-19 pandemic. Okay, so let's understand. We know that the COVID-19 cases are rising day by day, and as this number will increase in upcoming months and weeks, there will be a decline in availability of doctors and nurses. Apart from this, nowadays so many doctors and nurses, they are getting exposed to COVID-19, and that will further decline the availability of doctors because those doctors will have to self-isolate them. Now according to WHO, there should be one doctor per 1,000 population. But if we talk about availability of doctors in India, then this ratio is 1:1400. And if we talk about government doctors, then this ratio further goes up, that is 1:11,000. Now according to CBHI, that is Central Bureau of Health Intelligence, India has a shortage of 6 lakhs doctors and 20 lakhs nurses. Now if we compare this situation with the community pharmacy, we know that most of us, we are living within a 2 to 3 kilometers of community pharmacy, right? Community pharmacist is the most accessible healthcare professional and is the first point of contact between the patients and healthcare system, right? If we talk about rural areas or the underserved community where there is a shortage of physician, community pharmacist is the only accessible healthcare professional to the patients. Now, if we talk about activities of community pharmacist, then it varies from country to country. If we talk about India, then community pharmacist is the most underutilized healthcare professionals. So in this mid of public health crisis, it is very important to examine the role and responsibility of community pharmacist. That will lessen the burden on healthcare system and will help in improving the image or value of community pharmacist. I know that so many people will get offended with my sentence, but if I'll tell you the hard truth about the image of community pharmacist in India, then it is nothing more than a storekeeper. So this is the time, this is the situation, this is the opportunity where we can improve the image of community pharmacist by extending our healthcare services to the patients. Okay, so now let's understand the role and responsibility of community pharmacist in COVID-19 pandemic. So the pharmacist can play its role in 3 important key phases of pandemic, that is prevention, preparedness and response. Prevention का मतलब होता है to reduce the health risk imposed by the pandemic. Preparedness means to ensure the timely and effective response from the healthcare system. And the response means how healthcare system can take immediate action in response to a pandemic, right? So let's understand the role of community pharmacist one by one. So the first important role of community pharmacist is to provide factual and reliable information about the disease. We know that the spread of COVID-19 has left the entire world stunned, right? This disease has created so much impact across the globe that every individual wants to gather as much information as possible to ensure the proper prevention. But however, it is very much important for public to know that only right information can be helpful to them. right? In this situation where there is a reliability of information is very much crucial, the myths and the misinformation are spreading at a higher rate than the COVID-19 itself. For example, sunlight can kill the coronavirus, drinking alcohol can be helpful, holding your breath for 10 seconds can be helpful in identifying the disease. Such myths are spreading at a higher rate through the social media and internet. So because of all this misinformation, this pandemic is more dangerous than any before. According to WHO, we are not just fighting pandemic, but we are also fighting the infodemics. Infodemics का मतलब होता है that so much information about the problem, excessive information about the problem, that its solution becomes more difficult. Right? So in this situation of lockdown, where the access to the physician is limited because most of the doctors and nurses, they are busy with the COVID-19 patients, and so many OPDs are also closed to avoid the unnecessary crowd in the hospital. So in this situation, pharmacist is the only healthcare professional that is accessible to provide the information. So it is the prime responsibility of community pharmacist to provide reliable information and to prevent the spread of myth and misinformation. By providing high quality informations, community pharmacists can prevent the unnecessary scare or the threat in the public, and thereby it can reduce the burden on the healthcare system. So the another important role of community pharmacist is to educate public regarding infection control and preventive measures to reduce the transmission. So when the patient visits the pharmacy, it is the responsibility of community pharmacist to educate them about the 7 steps of hand washing techniques declared by the WHO. Pharmacists should also explain them about the importance of self-isolation and social distancing. Right? We know that in India, community pharmacies are very busy. So another way to do that is that community pharmacists can place the educational banner or the educational poster about the COVID-19 outside the pharmacy. Right? Pharmacists should also explain to the patient about proper usage and disposal of face mask and gloves. Right? Pharmacists can place the infographics regarding the proper usage of face mask outside the pharmacy. Right? He can also prepare the COVID-19 awareness templates and flyers and provide it to the patients who visits the pharmacy. Another important role of community pharmacist is to implement the infection control measures at the community pharmacy. We know that unlike other public services, community pharmacy will remain open during this lockdown to provide essential information, to provide essential medicines to the patients. So it is very much important to keep the community pharmacy and the staff of community pharmacy free from the COVID-19. Right? So Commonwealth Pharmacy Association provide 10 steps guidance to prevent the infection at the pharmacy premises. So let's see what are those 10 steps. Okay, so the first step is pharmacy signage. All the pharmacies should have banner or the standee outside the pharmacy advising the patients to do not enter into a pharmacy if they are having symptoms of COVID-19. And it should also have a signpost of the COVID-19 designated hospital with the contact details. Then the second step is wash your hands. All the pharmacy staff should wash their hands by following 7-step hand washing techniques of WHO on a regular basis. Then third step is self-isolate. If any pharmacy staff member develop the symptom of COVID-19, then they should self-isolate them for 7 days and should not come to the work. Then the fourth step is social distance. All the pharmacies should maintain 1 meter distance between the pharmacist and the patients, and pharmacists should also restrict the number of patients entering into the pharmacy at a time. Then the fifth step is face mask. All the pharmacy staff members should wear the face mask while handling the prescriptions. Then the sixth step is prescription handling. All the pharmacy persons should wear the gloves while handling the prescriptions. They should not handle the prescriptions without gloves. And then the seventh step is mobile phone handling. Pharmacists should encourage the patients to sanitize their phone by using alcohol wipes available at the pharmacy. The eighth step is cash and PC handlings. Pharmacists should wear the gloves while handling the cash and the PC. Right? The person who is handling the cash should not be the same person who is handling the prescriptions. right? The same person should not handle the cash and prescription at a time. Then sanitization of premises. Pharmacists should sanitize the pharmacy at a regular interval. They should sanitize the packages, floor, all the cells, everything on a regular basis. Then COVID-19 testing. Pharmacists should have a banner outside the pharmacy containing the details about the COVID-19 testing procedure with the contact details of the designated hospital. Another important role of community pharmacist is to maintain the continuity of pharmacy services, including supply of essential medicines and other products, and that can be done by two steps. One is by ensuring the adequate storage, and second is by maintaining the medicine delivery. So first, let's understand the role of community pharmacist in maintaining the adequate storage. So we know that with this lockdown, the people's behavior is also changing. With the household items, people are also stockpiling the medications, including OTC and prescription medications. And if the immediate action is not taken, then this can lead to a medication shortage. Okay. And the clinical consequence of medication shortage will be increased patient safety risks such as medications error and adverse patient outcome. So it is the responsibility of community pharmacists to maintain the adequate storage. And to do that, it is the responsibility of pharmacists to ensure the patients that there will be a continuous supply of medicines will be available at the pharmacy. Pharmacists should promote the safe and rational use of medications. They should encourage the patients not to self-medicate. For example, अगर हम बात करें तो initially when hydroxychloroquine and azithromycin was found to be effective in COVID-19, there was this sudden rise in the demand of those two medications. People who were not having symptoms of COVID-19 were also buying those medications, and such incidences can lead to medication shortage. So it is the responsibility of pharmacists to avoid such incidences. Pharmacists can also frame some policies to avoid unnecessary stockpilings. For example, they can limit the quantity of medicines to be dispensed. They can implement the 20 days drug concepts. That means that patients will be given medications for 20 days only. In this COVID-19, there is an increased demand of hand sanitizer, and which leads to the shortage of hand sanitizer at the pharmacy. So in these situations, pharmacists can prepare the hand sanitizer at the pharmacy premise itself. Right? USP, United States of Pharmacopoeia, has issued a guideline to prepare hand sanitizer at the pharmacy. Apart from that, to maintain the adequate storage, pharmacists should be given authority to give therapeutic alternatives or substitute in case of emergency due to lockdown. Pharmacists should also be given authority to refill the prescription in case of emergency. Such policies can be helpful in maintaining the adequate storage. Indian Pharmacy Association has already wrote a letter recommending those policies to the government. So now let's understand the role of community pharmacists in maintaining the medicine deliveries. So in this COVID-19 pandemic, pharmacists should offer home delivery services. And to do that, pharmacists can collaborate with the social workers, volunteers, and other care coordinators. Right? Pharmacists can also issue a hotline number and can encourage the phone consultations, phone prescription order, and home delivery services so that they can avoid the unnecessary crowd at the pharmacy premise. Right? So basically, pharmacists can combine ETP, that is electronic transfer of prescription, and home delivery services for the older and vulnerable populations who cannot come out of their home in this pandemic. And by doing that, pharmacists can ensure the medicine delivery to the community. So another important role of community pharmacist is in treating minor ailments. Right now, we know that the main focus is on COVID-19, but people will also develop symptoms other than the COVID-19 and the condition that require the attention. One study in UK shows that 1 in 10 general physician visit and 1 in 20 emergency department visit is of minor ailments, and community pharmacists can easily manage such minor ailments. For example, cough, cold, fever, gastrointestinal symptoms, skin rashes, etc. Right? So in developed countries, community pharmacists are also trained to treat infectious diseases such as influenza and streptococci. and by doing that they have significantly reduced the burden on the hospital and clinics, so that they can mainly focus on the high risk COVID-19 patient. So now if we talk about lower middle income countries such as India, Pakistan, China, then this business closure due to the lockdown is a death sentence for the daily wages and lower class people, as they have lost their jobs. They do not have enough money to spend on healthcare needs, and especially in the situation where many hospitals have closed down their OPDs and emergency department to avoid the unnecessary crowd in the hospitals. So with no way to go, no money to spend, these people, they travel to the nearby pharmacy where they get the consultation free of cost, and they'll only have to pay for the medications that they are buying. So this could be a great opportunity to showcase the role of community pharmacists in lower middle income countries, especially in this public health emergency situation. So another important role of community pharmacist is in promoting medication adherence. Because of lockdown, there is a limited access to the physicians. So many hospitals also have closed down their OPDs, and people have started losing their jobs. So people do not have enough money to spend on their healthcare needs. So people are either cutting down or terminating their medication therapy. But this non-medication adherence will ultimately place an additional demand on this already overburdened healthcare system. So in this situation, it is the prime responsibility of community pharmacists to promote the medication adherence, so that patients do not worsen or do not deteriorate their current healthcare status. So another role community pharmacists can play is as an immunizer. Currently the vaccine is not available for COVID-19, but when it does become available, community pharmacists should be trained to administer the vaccine. There is one data in USA which shows that in the year of 2013, 4.1 million additional people were vaccinated for the influenza by the effort of community pharmacists, and which has significantly reduced the number of infections in that year in the USA. So currently vaccine is not available, but when it does become available, there will be a high demand of that vaccine. Almost all the people in the community, they will try to get the COVID-19 vaccine. So in those situations, if pharmacists will be trained to administer the vaccines, then we can significantly increase the number of vaccinated people in the community. Okay, so that's all about the role and responsibility of community pharmacist. So we can conclude that pharmacists can play so many other role and responsibility apart from just dispensing a medication. In developed countries, pharmacists has already changed their perspective from business centered to patient centered. In developing countries like India, it will take time, but in the midst of this public health crisis, this is the right opportunity for pharmacists to shift their image from business centered to patient centered. Okay, so if you enjoyed this video, then don't forget to subscribe, like, share and comment.